Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, sleep apnea, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist, sleep coach, functional breathing instructor, and formal dental hygienist, I'm sharing stories and tips to help you identify if myofunctional therapy is right for you and how it can help improve your overall health. Visit the show notes and take our quiz. Is myofunctional therapy right for me? Are you ready to feel better? Find the quiz to see how myofunctional therapy can help you and your family live your best life. Hello, and welcome back to another episode of Myo360. I am your host, Becca Rose. Today, we are going to be talking about dental health and mouth breathing and how this can lead to cavities, gingivitis, and even bone loss around your teeth. So in episode 22, I had a guest on, Amy H., and she talked about her myofunctional therapy experience so far, her first couple visits. And she talked about not knowing that the way we breathe can change the biome in your mouth. So, I thought it might be a good idea to maybe expand on that a little bit more and talk about how mouth breathing can affect overall dental health and gingival health. So, you can also look back to episode 17, and that is about children and how snoring and mouth breathing in kids can potentially cause some havoc on their growth and development and cavity production in younger children as well. So check out 17 and 22. All right, let's get to it. So we're going to talk about dental health today and mouth breathing and how myofunctional therapy can be a way to bring some of those things together to help improve overall general health, oral health. It does not matter if you are a child or an adult. So many of us breathe through our mouth and we don't even realize it. And most of the time, what's the big deal? Well, I breathe through my mouth. Who cares? It's okay when it's done in small bursts of time, like during very intense exercise. But when mouth breathing becomes a habit or it becomes the main way that you breathe during the day or during the night, it can have a significant impact on your overall health and your oral health. So today we're going to dive in a little bit deeper into the world of mouth breathing in the mouth and explore some of the potential consequences that could result from over breathing through the mouth and discover how myofunctional therapy is going to help with that. All right, mouth breathing. What's the problem? What's the big deal? We have to understand what mouth breathing is in the first place. Like I mentioned, it's not just about, that occasional excessive exercise, really intense cardio, and you have to breathe through your mouth. We're talking about habits here. We're talking about prolonged disuse of the nose and how that then leads to the habit of mouth breathing. When people come in for evaluation, part of my job is to determine, is your mouth breathing a habit that you've been doing your whole life and you don't know how to undo? Or is there potentially some sort of structural issue at play here where you may benefit from seeing an airway-focused dental provider or an ENT to make sure there's no structural components preventing you from breathing through your nose? So far in my experience, I find that most of my people are habitual mouth breathers. There could be many, many different reasons why someone breathes through their mouth. If you're a child, it could be enlarged tonsils, enlarged adenoids in children, allergies, deviated septum. All of these things will change the facial structure, and that often leads to some of that mouth breathing, even if there's no real medical reason behind it. Allergies are a big one. If we have uncontrolled allergies and we're just stuffed up all the time, we default to mouth breathing so we can survive, right? We got to breathe. And then that over time just becomes a habit. Or kiddos who are very sick, chronic coughs, colds, infections when they're young, that can often lead to a habitual mouth breathing situation to where it's no longer a structural type of issue. It's just become a habit. So part of my job is to help you break that habit and learn how to use your nose again the way it is supposed to be used. Now, what are some of the consequences of this harmless habit? Dry mouth. That's a big one. When your mouth dries out, the bacteria in your mouth has the chance to overgrow and overpopulate. Many people are unaware that cavities are actually caused by bacteria. So, if the mouth is very dry from chronic mouth breathing, or in adults, maybe medications are drying out the mouth, which is a very common side effect of about 90% of medications. The mouth gets dry, the saliva doesn't have the ability to wash and flow over the teeth. This allows the bacteria that causes cavities to proliferate. It grows, it has more activity, and it's allowed to thrive. And then when you add sugars and other dietary acids, things in the diet that increase bacterial activation with dry mouth, the bacteria are like, yay, we have everything we need to grow and grow crazy. And that's when we potentially start to see increase of cavity rates in children and even adults. Gum disease, a bad breath, these are also things that can be a result of dry mouth, among other things. Gum disease is one that isn't really talked about much in regards to dry mouth. Gum disease is essentially when the gum tissue that surrounds your teeth starts to become inflamed and enlarged. So this might start as gingivitis. When you go for your dental cleaning appointments, you may receive feedback from your dental hygienist that says, yeah, your gums, they're a bit bigger than they should be, and they're kind of puffy, or they're red, or they bleed easily. Let me tell you that bleeding puffy gums are not because you flossed your teeth too hard. It is because you don't floss your teeth maybe as often as you should. Now, this is not meant to be like scolding anybody on their dental hygiene, but there's a lot of misunderstanding about the role of floss in dental hygiene and mouth breathing. Anything that goes between the teeth to clean the teeth is going to remove that bacteria, because if we don't remove it, it stays up underneath the gum tissue and it doesn't get bothered and we don't floss it away. And then that's where it has the chance to start growing into stronger colonies of bacteria that eventually start to break down the gum tissue. It starts bleeding it. And over a lifetime, that bacteria can become so strong that it starts to actually eat away at the bone that holds your teeth in your jaw. So when you hear about adult tooth loss, that doesn't have to do with cavities or injury or accidents. It's usually due to bone loss or gum disease, long term gum disease. The bacteria has played a huge role in breaking down the bone. The dry mouth on top of it exaggerates that process, and there's just so much chance for the bacteria to proliferate and grow and lead to more dental problems. Now, mouth breathing is also going to cause long-term facial changes, especially in children, right? Mouth open means tongue is low. If tongue is low, it is not in the roof of the mouth, helping to shape the form of the upper jaw. The tongue is then falling into the airway, and then we start to see things like long, narrow faces in children, a jaw that is very set back, and that all impacts the airway. We're also seeing a lot of sleep disorders, sleep disordered breathing, upper airway resistance with chronic mouth breathing. One thing that's also not well understood or known is that if you are a chronic mouth breather, you're snoring and have sleep apnea, there's also a high likelihood that you may have some trouble with GERD and acid reflux. If you're on a CPAP machine, that's going to dry out your mouth even more. And oftentimes the mouth is open, even with the CPAP machine on. So we're not even getting the full use of our CPAP the way it's intended to help us with sleep apnea. So keeping that mouth closed is just, it's huge. Really, we need you to sleep good. We need children to develop good skeletal structures, because that is what's going to shape and manage their airway as they grow. So, where does myofunctional therapy play in this? Well, myofunctional therapy, first thing I mentioned, we have to make sure that your mouth breathing is a habit and not a structural issue. Some of the tests and maneuvers I ask you to do help me to figure out, all right, this is a habit and we can break habits. And that's part of what myofunctional therapy works on is breaking habits. So we can learn new habits that will actually be sustainable and beneficial to our overall health. We're going to give you tongue exercises. And it's important to know that myofunctional therapy and tongue exercises is not just about making strong muscles. There's sometimes a misconception that exercises found on YouTube are going to solve all your problems. Well, they really will not because they're not tailored to you. And strong muscles are not the same as functional muscles. So we need to make sure that we get your tongue muscles, your mouth, your throat, your face working functionally because the function is what is going to improve your symptoms. It does not matter how strong your tongue is or how strong your muscles are. If they don't function, they are still not going to do the job that they are supposed to do. I'll oftentimes use the example of a bodybuilder, massive amount of strength, right? Huge muscles, but reaching back to scratch their back is hard, or maybe bending down to tie shoes is hard. So just because you're strong doesn't mean you have the function you should have. The same thing goes for our tongue and our throat. They have to function, and that's what we teach you how to do based on your abilities and tailor it to what you need and how your muscles are currently working. Breathing exercises are a huge part of mouth breathing or trying to reduce mouth breathing because we have to get that nose working again. And in order to get the nose working, we need it to breathe. We need it to be clean. So we talk about nasal hygiene and different kinds of functional breathing exercises that are going to help wake up your nose so that it can do the job it needs to do. It needs to warm up the air before it gets into your lungs. The nose is so important. So sometimes, though, we need a little bit of extra help. And if there isn't enough room in the mouth or the mouth is too small, we might need to connect you with a provider who's going to help to grow your airway and grow your mouth. And sometimes that might mean an appliance or some sort of expansion device might be beneficial in helping you to grow your airway so that you can breathe through your nose and shut your mouth. All right. Myofunctional therapy is beneficial for all ages. I myself start with children around age 4 or 5, depending on their abilities. There is no upper age limit to myofunctional therapy. My oldest client was in their 80s, and I recently had a pretty big rash of 60s and 70-year-olds coming to find me for sleep issues. So there is no upper age limit, and it is never too late to improve your health. Learn how to close your mouth and breathe through your nose. I've heard so many stories from my patients about how tongue posture has just tongue posture by itself has opened up sinuses and allows them to breathe easier through the nose. And then we start adding these muscle movements to it and getting things functional. You will start to feel better and will start guiding your health on the right road. Let's start when kids are young. The younger they are, we're able to help guide some of that growth as well so that they can have strong airway function, chewing and swallowing, breathing for the rest of their life. All right. So if you are suspecting that you are mouth breathing or breathing more than you thought, the first step is to consult with someone like me. It's easy to find out if myofunctional therapy is right for you. Take the quiz. We have a quiz, and it's a first easy step to see if this is right for me. Is myofunctional therapy right for me? That's right in our show notes. So take a look at that. Start with that. And then if you have more questions, reach out to me or another myofunctional therapist, and let's find out if your mouth breathing is a habit or if there's something else going on. Stay tuned for our next episode. Next time, we are going to talk about how mouth breathing affects child development. So stay tuned for that. and we will catch you next time. Thanks so much. Have a great day. And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.